Hi, I'm going to talk to you about a new REF classroom that I'm doing based on this unified approach to ILDs, all very serendipitous. And as I explained in the ctchestreview.com post on the 8th of July, I created this approach after some new data and information and papers that we've had over the last 3 to 4 months. But that hadn't come out very well. And so then I spent some time doing this again on PowerPoint and adding a few things like PPFE, CPFE, things that had been left out. And I said, this is a great template to understand step by step how to build knowledge about interstitial lung diseases. And so then I said, let's do a classroom based on this. And so we have a 15-week course from 17th August to 23rd November, a unified approach to ILDs, building knowledge step by step. And today is the introduction. The curriculum will be taught using Google Classroom. It's meant for all doctors interested in diagnosing ILDs. It's an asynchronous online course, which means each Sunday at around 8 a.m. I will upload a 4K video. It's through YouTube, but you can only access it through Google Classroom. And you'll have classwork of about 2 to 4 questions. It's not live, it's not like Zoom. I will not be physically present, which means you can view the lecture video at your time and convenience. And you typically will have 2 weeks in which to view the video and complete the classwork. With longer time available for weeks 1 to 3, because you can answer till the midnight of 20th September. But the assignments of week 13 will have to be answered within a week by the midnight of 15th November. The classwork will not be graded, but each participant must complete about 80% of the assignment. So what's the curriculum? And the curriculum is based on this flowchart. Typically, when we look at CT scans, we look for interstitial lesions, and these are the ones that we would look for. And so the first week will be just defining the terminologies of these interstitial lesions, the 3 that constitute fibrosing ILDs, the 5 that constitute non-fibrosing ILDs. Once we've seen interstitial lesions, the next question is, are they real, or are they seen just because it's a poor quality scan, or is it a mimic? And so week 2 will be about defining what a good scan is, and in turn what a poor scan is, and what mimics are. So the mimics are things like friction fibrosis, when there are large osteophytes, or gravity dependent densities, or aspiration changes, and poor quality related to poor breath hold, expiratory scans, and we'll discuss all of that. Now, if the patient has real lesions, then the next question is it an ILA? Is the patient asymptomatic, has normal PFTs, and has been picked up on screening when the patient otherwise doesn't have any symptoms and has no other problems? Or is the patient symptomatic, has abnormal PFTs or disease, in which case it becomes an ILD? And so week 3 will be all about interstitial lung abnormalities, the various subtypes, and the new ATS definition. Now, if it is an ILD, then the next question is it fibrotic or non-fibrotic? And when it's non-fibrotic, we have these 5 signs that may occur singly or in combination, and then based upon the pattern, we would make specific diagnoses. And so the next week, we'll be focusing on these 4. That's week 4 and 4 signs: ground glass plus consolidation, septal thickening. And we look at the nuances of making these diagnoses, including organizing pneumonia patterns. Week 5 will then be about the 2 remaining signs of ill-defined and well-defined or discrete nodules. And we look at all of these entities that can simulate interstitial lung disease. And we look at this flowchart that I had created a year and a half ago or 2 years ago that looks at how to evaluate these nodules on CT. Now, if the disease is fibrotic, Then the next question is this UIP or non-UIP? And if it is UIP, and that includes typical probable UIP, is it primary, which means there's no etiology and it's idiopathic, or is there an etiology? And so week 6 will be all about that. We will cover typical UIP, probable UIP, IPF when there's no etiology, or other conditions like asbestosis and familial etiologies where we have a cause for the UIP pattern, as in this patient who has asbestos ILD. These are pleural calcified pleural plaques, and the patient had worked in a brake lining factory. Now, if it is non-UIP, which means it's a fibrosing ILD, but there's axial distribution, upper mid-zone predominance, air trapping, associated ground glass nodules, then these are the various entities that we're looking at. And I've put PPFE here because it is by definition not a UIP, or rather it's a reverse UIP, and so it best fits in here. And so week 7 will be all about that, and we look at different causes of non-UIP patterns, including fibrotic HP. We will look at PPFE and the pneumoconiosis. Now comes the big change and the population of this flow chart. So there are many conditions that can have overlap patterns. They can have UIP-like patterns, they can have non-UIP patterns, they can have just ground glass septal thickening, consolidation, and the biggest of those is connective tissue diseases. And you can suddenly see how we're looking at NSIP, which can be both non-fibrotic or fibrotic. We're looking at variant forms of UIP, and you can see the list here. We're looking at non-UIP conditions also causing connective tissue diseases, or other CTDs presenting with non-UIP patterns, and CTDs having ILAs. And so these arrows perhaps should be bi-directional. And so week 8 will be all about variant fibrosis, NSIP, and connective tissue diseases. And we look at all of these signs that tell us that there's underlying connective tissue disease, including the straight edge sign. We will look at different types of NSIP, whether they're, how to diagnose NSIP, and then whether this is non-fibrotic, fibrotic, whether there are mixed patterns. We look at the different CTDs and look at the different patterns within them. Example, this patient with DM who has a mixed NSIP OP pattern. Similarly, HP and sarcoid have different manifestations, and we will in week 9 look at them separately. So we look at non-fibrotic HP, fibrotic HP. We will look at different types of sarcoid, including the PMF pattern, etc. Smoking also impacts different parts of the lungs and has different manifestations, from a simple respiratory bronchiolitis to a UIP. And so week 10 will be smoking related diseases, and I will add CPFE here, which we've just added out here. And we will look at all of these conditions. They were all seen in a single patient, but we'll examine each one of these one after the other. Similarly, we will look at vasculitis, which also has differing patterns depending upon the timing of the disease, the type of disease, and week 11 will be all about the various forms of vasculitis that affect the lungs, as in this patient who has GPA and has just presented with multiple cavitary lesions and consolidation. Similarly, medication-induced, radiation-induced, when we look at the new PD-L1 inhibitors or sulfasalazine, mesalamine, they all, or nitrofurantoin, they can all have different lung injury patterns ranging from an HP pattern to an NSIP pattern to fibrosis. And so week 12 will be about medication, radiation, etc. induced lung injury, as in this patient who had nitrofurantoin related lung injury and this patient who had radiation lung injury. Lastly, we will look at what happens to all of these conditions when they progress, and what are the ways in which to pick up progressive pulmonary fibrosis. And we will look at the various complications. All of these conditions can have acute exacerbation, they can have superadded infection like tuberculosis, other bacterial infections, and there is an increased incidence of malignancy in patients with IPF and some other ILDs. And we'll discuss those in week 13, where we look at PPF and complications in ILD. This is a patient with PPF 6 years apart, and then this is a patient who has superadded pneumonic consolidation in the left upper and right lower lobes. So that's what we will be doing over 13 weeks. We will look at each component and build our understanding starting from the signs and then going through all of these issues and asking questions at each stage. And so week 14 will be a quiz with 15 questions to test your knowledge, which you have to answer in a week's time. And you have to get 33% correct if you want a certificate. So a certificate will be given only to those who complete 80% of the assignments. You don't have to get these assignments right. You just have to complete them and get more than 33% in the final quiz assignment. And so 15th week will be all the quiz answers, which I will put up in the form of a video with explanations as to why that answer is what it is. So that could be a longer or a shorter video. It depends upon the questions that I have put up at that time. And these videos will all be available for viewing throughout the duration of the course. So you can always revisit a video that, let's say, happened 8 weeks ago, and then they'll be available for 2 months after, till the 31st of Jan 2026. So it's all about building an understanding of ILDs, basic to advanced, one step at a time. If you want to register, then that's the QR code and that's the URL. There is a special 20% discount for members of paid or comped members of ctchestreview.com, and there is a 20% discount to residents. The rest of the stuff you will find at the registration site. REF since 1996. Thank you so much.